Welcome back. Today we're going to talk about carpal tunnel syndrome. You know, more people actually get it than you think, and while it might not be a broken leg or something catastrophic, it really can mess up your hands, your wrist. It can be painful.
Yeah, but there are ways to correct the problem, and one of those ways is by visiting Comprehensive Orthopedics in Meriden. That's where I met up with Dr. Hudson Seidel, such a great guy, an orthopedic hand surgeon, to learn more. Take a look. We're here in Meriden today at Comprehensive Orthopedics with Dr. Hudson Seidel. Doc, good to see you.
Good to see you again.
All right, we just shook hands and there was no pain, there was no problems.
Not at all.
However, we are talking about carpal tunnel syndrome today.
That's correct.
What is carpal tunnel syndrome?
So carpal tunnel syndrome is basically one of the main nerves in our hand, the median nerve, where it runs in a tunnel in our wrist called the carpal tunnel, hence its name. It gets compressed, and basically the way it manifests is a little bit different. It causes compression in the nerve, which causes what I say is a hose to be kind of kinked, and so it's not giving the same impulse it normally should.
Okay.
And you'll feel usually numbness, tingling, and then pain.
I was going to say, what are the symptoms of carpal tunnel? How do you know you have it?
You know you have it when you have a lot of numbness, tingling, things like that in your hand. Sometimes people even have difficulty with daily tasks like buttoning your shirt or doing a button on your pant legs, things like that. But a lot of times it's manifested at night. So you'll feel it mostly in the night. If you're waking up tingling, you have to shake your hand out. That's kind of the first symptom most people feel.
I used to hear carpal tunnel, but like, oh, whatever, just get over it.
Right.
But it's debilitating for people.
Especially a lot of people don't come in until things have progressed pretty far in terms of you can even have weakness or loss of this motor function of the thumb right here. And you can have like sustained numbness. When your numbness has been there for years, it may not come back after time.
Is there any course of action other than surgery?
Of course. So a lot of times when I first see somebody for it, we talk about braces, especially at night, are very helpful. Injections can actually be super helpful for a lot of people, especially pregnant women who get carpal tunnel a lot. And it also relieves the symptoms at least for a couple months at a time.
A couple of months at a time, but prolonged, sustained relief, surgery?
Usually that's the ultimate answer for a lot of people is surgery. Surgery, I think, is a scary word for a lot of people.
Right.
I like to call it a procedure. It takes about 5 to 7 minutes.
Oh, that's it?
Minimally invasive, small incisions, and you can even be awake during the procedure if you wanted.
And that's done here?
It is done here in the hospital, yes, correct.
That's fantastic.
Outpatient center. And we have good studies that say that earlier treatment has great results and has better results than somebody who lets it progress to severe. Once the numbness really sets in, it's really hard to fix afterwards.
Is it hereditary? Do we get it by working with a mouse or things like that? Or
those are great questions. So it's actually all. So we know there's a component of hereditary for sure, so certain family members will have everyone that gets it. There is a component of certain activities or specifically professions such as typing, desk jobs, things like that. And then anything that requires a lot of repetitive use or flexion extension will cause that as well.
Okay, and again, a 5 to 7 minute procedure.
On average, yes.
That's amazing. And you're pretty good at it.
I'd like to think so.
Here's the amazing video of Dr. Seidel performing the procedure. Isn't this incredible? And here's the tool he uses up close. It's pretty cool.
So, Doc, what are we looking at here?
So this is actually the device I do for what's called your endoscopic carpal tunnel. So there's 2 ways to do it. One's with an open incision in your palm. It does great as well. I use this typically for my younger, more active patients, people that want to get back to work faster. It hurts a little bit less because I can make a smaller incision and cut through less layers, basically. You can see the camera.
It's like a magic wand.
It's like a magic wand. It's smaller than a pin. It fits right in here and allows me to do this all connected just to an iPad in the operating room. And this is actually the blade I use right there to release it.
So there's a blade in there as well.
Yes.
So that's what does the cutting?
Mm-hmm.
And this is literally the instrument that you use?
Correct. Sterilely right there. I've got, I think, 5 or 6 of them tomorrow. Same one.
That is really remarkable. So we're looking at just us here.
Correct. If you want me to take it out, you can look just at you.
And that little tiny incision, so it's not going to be a big incision.
No.
And again, a 5 to 7 minute procedure.
Hide it right here in the wrist cleage. Never even knew you had it.
And what is the recovery rate? What do you have to do? Physical therapy or anything like that?
Most patients don't go to physical therapy. I always offer it. I think that it's great if they want to go. But usually you're I tell you, you're boring for the first couple days. You take a, big dressing that I put on it for 1 day, you take it off and put a Band-Aid over it immediately.
Okay.
There's some glue that covers it up. You can shower, and most people can go back to work within a few days after the procedure. It does take about 6 weeks for your full grip strength to come back. But
six weeks?
Yeah, for you to be fully open in jars and tightening things, gripping and everything. But I had a patient one time ask me if they could go back to chainsawing at 2 weeks after their surgery.
Holy Hannah.
Yeah.
That's pretty incredible.
Yes.
All right, so as we close the piece, I'd like to present you with a joke.
Okay.
I was in New York the other day and I took the Holland carpal tunnel. Is that any good?
That's excellent. I love it.
Thank you, Dr. Seidel.
Always a pleasure.
Pleasure to see you.
Good to see you too.
Oh my goodness. And just so you know, he wanted me to pay attention. He's like, hang on, it's coming, it's coming, it's coming.
Yeah, the joke was coming. But such a nice guy and so knowledgeable. Comprehensive Orthopedics has offices in Wallingford, Southington, Cheshire, and Meriden. If you would like more information on all of these services they offer, please visit comprehensiveorthopedics.com. And if you see Dr. Seidel, you got to tell him we said hello. He's the nicest guy.
Yeah, great information for people. You don't have to suffer.
You don't have to suffer.